29th day of the government shutdown. What are your feelings? Most people are on edge right now.
Yeah, I tell you what, I understand that because we're so far into what is now the longest complete government shutdown that I recognize wholly that it's having a negative impact on a lot of families in East Texas, as it is across the nation, and it's unfortunate. House Republicans back in September passed a full funding package to extend government funding to keep government open, keep it working for the people. Unfortunately, the Senate Democrats continue to block that. More than 10 times now they voted to block that since October the 1st, and that's unfortunate. And now, as we run up to November the 1st, we're seeing even greater impacts come online.
And what are you hearing from your colleagues and constituents? What's the feelings among the GOP about this current shutdown?
Well, I tell you, the constituents in East Texas have said stand your ground because they recognize that they do not want us to give in to long-term bad policy decisions simply because the Democrats are holding a government hostage in this moment to try to get us to bend over and to accommodate some really bad policy decisions. And so we're not going to do that. We're going to stand strong. But what we're also going to do in the midst of that is stand reasonably. And that's what we've continued to do. Now, this week, November the 1st, we're going to see nearly 42 million Americans that are dependent on SNAP. That's going to end because SNAP is going to run out of money, and by about November the 8th, we're going to see problems with WIC as well because we're going to run out of money there, and probably by about middle of November, we're not going to have money to pay our military troops. So a lot more consequences are coming down the line right now. Already air traffic controllers, TSA agents, a lot of Border Patrol folks are not getting their paychecks or having to work. We've got a lot of furloughed employees that are not able to be responsive to constituent needs at the federal government level. So the shutdown is not good for East Texans, it's not good for the nation, but we cannot give in to the unreasonable policy demands of the Democrats just to get back online.
And Congressman Moran, you brought up a good point about the SNAP benefits. Come Monday, if nothing changes, we will have 42 million Americans who will not get their SNAP benefits. We talked to the East Texas Food Bank CEO David Emerson yesterday, and he says around 11,000 federal employees in the food bank's 26 county service area are affected, along with 178,000 SNAP recipients who rely on monthly food assistance. Once those benefits stop, Emerson says that money families simply won't have enough to buy food. What is your reaction to that?
Yeah, we so appreciate the East Texas Food Bank and their desire to stand in the gap for families that have critical needs, not just in this moment, but for years going on across a large region in Northeast Texas. And we spent some time with them actually today in their board talking to them. We promised them early on that we wanted to have these conversations throughout this year as things begin to change, and certainly now during the shutdown, we want to have conversations to see where can we stand alongside them, how can we support them, because as the government's ability to pay out SNAP benefits or provide those benefits or WIC benefits no longer exists in the shutdown because of what the Democrats are doing, we want to be able to make sure that we stand with those entities that are filling that gap. East Texas Food Bank is doing that, and we so appreciate their work.
So in the current moment, Republicans are calling for an extension of the current budget. Democrats want an extension of the Obamacare tax credits. Both sides are dug in. Do you think both sides in many ways have sort of boxed themselves in, and how do you see this resolving?
Well, again, the question is about reasonableness and who is being reasonable and who is not being reasonable. And let's start with the Democrats, because on the health care piece, let's make clear that we're not talking about all of the ACA health care subsidies that are up for potential expiration. We're only talking about COVID era expiration of those COVID era enhanced subsidies that were put in place by the Democrats. And when the Democrats put it in place 4 or 5 years ago, they set a termination date of the end of this year, December 2025. It's coming to an end naturally. We know the pandemic's over, so those enhanced subsidies that are going to folks that some are making $500,000, $600,000 a year and receiving a subsidy, we have not seen good fruits out of that subsidy in the last 4 years. As you would expect, government subsidies drive up the cost of health care. They have driven up the premiums that consumers are paying. The only beneficiary really to the enhanced premiums have been the health insurance companies. And so for the Democrats now to feign that they are concerned about what's going to happen at the end of the year when the program that they set as temporary is going to expire on the terms that they set, well, I think that's pretty unreasonable for them to try to attach a permanent extension that would be more than $420 billion cost to the taxpayers and does nothing really to relieve the premium increases in the ACA healthcare program that started many, many years ago.
Well, just to build more on this healthcare piece of all the things that both sides disagree on, and we know there are plenty of things that, it's divided, but does this seem that healthcare piece is a critical divider? Give me a sense of what this could mean for Americans if this does happen.
I think really it's a political divider for the Democrats, and they see it as a political issue, and that's unfortunate that they're not focused on good policy, but they're focused on political wins and holding the American people hostage during this time. It's really a matter of, hey, we know this is not a good policy long term. Why would we double down on this? Why would we make it permanent? Why would we continue to drive premiums up for the consumers and only help the profits of the health insurance companies? There's better ways to deal with these healthcare premiums increasing. We need more transparency. We need PBM reform, things that Republicans have already passed that we're waiting on the Democrats to help us pass in the Senate and get to the president's desk. Those are the things that is going to actually help Americans with their healthcare costs going forward. We cannot move closer and closer to a single payer system that's run by the government. We cannot do that. That'll be bad for Americans long term. It's bad in the short term. And when you're attaching that to a 7-week CR, a CR that Democrats have voted for more than 13 times before we got to September, but now have voted against more than 10 times since October, simply on political grounds, I think that shows the disingenuousness of the position of the Democrats.
And Congressman, this week you announced that you requested to pause your salary until the end of this government shutdown. What was the moment that made you decide to request your pay be withheld?
I can't even conceive of receiving a paycheck when so many others that have no ability to be a decision maker at the table are having to feel the negative effects in the middle of this. And so for those people that are caught in the middle that aren't receiving their paychecks, I told my staff early on, we need to be in that same position because we need to feel the impact of the decisions that we're making. There's only 435 members of the House and 100 members of the Senate that are really at the center of this, that are the reason why we can't get this thing passed. And we should feel the negative consequences of our own inability to get a decision done and a bill passed into the president's desk. And until government is fully funded and we get the appropriations bills passed and we get other people getting paid, I'm not going to take a paycheck. I don't think that's the right way to go.
And let's switch gears and talk about that tele-town hall that you held last night. How did it go, and what was the overall tone or mood from your constituents?
The tele-town hall that we held from Washington, D.C. last night went extremely well. We called out to about 85,000 folks in the district, trying to get as many people to join as possible. We had some of our best responses that we've had in any of our tele-town halls. And we answered more than about 20 questions, just one after the other in rapid succession, trying to make sure that people had direct communication with their United States representative, that their congressman was responsive to them, transparent, and accountable to them for what's going on in D.C. We didn't take softball questions. We took the hard questions both on the telephone and online to answer for East Texans so that they are not getting misinformation or disinformation from other sources, but the source they're getting their information from is the one that is accountable to them. I'm supposed to be the voice of those individuals from Northeast Texas in Washington, D.C. They deserve to hear from me, and they deserve straight answers from me. And if you were on the tele-town hall last night, that's what you got. Straight answers. Regardless of which party you're associated with, we want to give you straight answers and facts that you can depend on and make decisions based upon moving forward.
And after hearing directly from East Texans, Congressman, has anything you heard changed or reinforced your approach to handling the shutdown?
Overwhelmingly, the people in East Texas support the position that I'm taking right now, support the position that the Republicans are taking. They understand that the policies the Democrats are trying to attach to the 7-week CR are not good policies either in the short term or the long term for the American people. They also understand that the only way for us to ensure that we don't have those policies locked in long term is for us to stand firm in this moment, as Speaker Johnson has called us to do. And frankly, Speaker Johnson has done a great job leading us through this shutdown time period, this Schumer shutdown, making the communication direct, just simply to say to the Democrats, vote for the same appropriations bill now that you have voted for, Democrats, so many times before. It's a Biden-era appropriations bill. It continues those Biden-era spending levels. It does not attach any partisan policies to it. It's a clean CR. There's no reason from a policy standpoint that Democrats would resist this bill, except that they're concerned about the politics.
And was there a specific story or question from a caller that stuck out to you?
No, I mean, so many good questions last night, and they came from all over Northeast Texas. We had them from Texarkana down to Longview, over to Tyler, up to Mount Pleasant, everywhere in between. We had a lot of questions last night. A lot of folks on there. I think more than about 5,000 people actually stuck with us through the call, and that was significant. A great opportunity to talk to people about what they're concerned about and how it's impacting that. I will mention, I mean, we had one that was saying, look, we've got a family member that works as a federal worker in a federal prison, and this family member doesn't have the ability to continue to pay their bills as they want to because we know so many people live paycheck by paycheck. And when you look at the military, when we get to November the 15th, we're probably not going to have any money to pay our military. If we can't get it solved before then, most military members on average have about $3,000 of savings. And we cannot put our military men and women in that position to not get a paycheck. I applaud President Trump for making sure they've gotten paid thus far. But at some point, we are going to run out of money, even for the military.
Congressman, there is a lack of trust in D.C., and this isn't something new with this government shutdown, but how do you restore that moving forward?
The lack of trust, I think, certainly comes from both sides, Democrats and Republicans, making decisions that's based on politics and not on good policy, not listening to their constituents, looking for more of a sound bite rather than sound policy, and that is not the way to go. You have to stay connected to your constituents. You have to understand the real-life impact of the decisions that we're making here in East Texas and for whatever congressional district that my colleagues represent. And then you got to go back to Washington, D.C. and do what's right, even if it is not the most politically expedient thing. And that's what we try to do day in and day out for the people of East Texas.
Congressman, last topic I want to discuss with you is about rural health care here in East Texas. Do you feel like East Texans and small communities have the access to health care they need and deserve?
No, they don't. Rural America generally does not. That's why the Rural Health Transformation Fund was so important. That $50 billion that we got put into the One Big Beautiful Bill this summer, that's one of the issues that is at the table right now, and one of the reasons why the Democrats are pushing so hard on this issue. They want to actually take away that $50 billion. The Republicans are saying, no, 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 no. Rural America needs that Rural Health Transformation Fund to shore up rural health care, access to care, quality of care. We need to make sure it's there, but the Democrats are demanding that we pull that back out, even though it was a great win for rural Texas and rural America in the summer. They want to pull that out. They want to undo eligibility requirements that we put in the One Big Beautiful Bill for Medicaid, making sure that only those that that need it and are eligible for it have access to it, and those that are not eligible for it should not have access to it.
In Trinity County, a rural hospital closed just after 14 months after opening. What's making it a challenge to keep rural hospitals afloat?
Well, you don't have the population. I mean, that's where you can start right there. It's hard, generally speaking, when the geography spreads the population out and you don't have the concentration of population that would drive up demand in any one center. And so we see that here in Northeast Texas, where folks have to drive 30, 40, 45 minutes or an hour to get to the health care that they want, that they need. It goes back to some of the problems we're seeing even with the ACA program. We talked about the subsidies. 40% of those that are using fully subsidized ACA programs did not go to the doctor one time last year. That's not a great use of resources by the federal government when we're talking about what are we going to invest in or subsidize. Certainly not a great investment at all. But it also speaks to the fact that there's a lot of people out there that aren't going to the doctor, that need to see the doctor. And in East Texas, sometimes that's hard when you get outside of the metropolitan areas and you're in the deep rural parts of East Texas. It's really hard to have that access to care. Telemedicine's super important, but we need to continue to support this Rural Transformation Fund and not bend to the Democrats who want to take it out.
And when a hospital or clinic in a small town closes, it doesn't just impact healthcare in that area. It also can devastate the local economy. How do you think Congress can help?
We need to continue to do the things that we did in the One Big Beautiful Bill, and to make sure that our programs are not growing so big and fat that there's so much excess that we can't actually direct the funds where they need to go, that we have people that are ineligible to receive Medicaid benefits, for instance, that are then sucking up all the money in that system, where that money could be better used for people that actually need it, that we can find ways to get them access to care in the rural areas. But our programs at the government at the federal level have become so bloated and inefficient that we can't do the things that we want to do, and so we're spending money in places we don't need to be spending them. We also need more transparency and accountability when it comes to PBM reform. We've talked about this with a lot of independent pharmacies. When you get in rural East Texas, access to pharmaceutical benefits is really important, and PBMs these days are just not working the way they should. They're abusing the system in a lot of ways, and as a result, independent pharmacies are going away. Access to pharmaceutical care is not where it needs to be. We've got one county in our 17-county congressional district that doesn't have a pharmacy in the entire county. And the last one there closed last year, and it's unfortunate. So we need more PBM reform, and we need more support in areas where it actually makes a difference for our rural health care.
Last question I have for you, Congressman Moran. For people watching us online right now, what's the biggest message you want to get across to people at home, knowing that we're dealing with this government shutdown? Some people are in fear of losing their SNAP benefits.
Well, my message would be this: don't fear. We're going to get through this. I predict we're going to get through this in the next couple of weeks. I think we're going to be back open before the middle of November. I could be wrong, but that's my belief. Just looking at and reading the political tea leaves, just hold steady, hold fast. There's a lot of nonprofits out there, a lot of church organizations, a lot of local entities that are stepping up to fill the gap in this moment. We've already mentioned one, the East Texas Food Bank. We're so grateful for, but so many others out there. We've got some information on our webpage that would point people to resources that are out there. I know Texas Health and Human Services Department is doing the same thing. Stay steady, stay strong. Remember, there is hope. There is going to be an end to this, and I think it's coming quickly.
Alrighty, Congressman Nathaniel Moran, thank you for your time.
My pleasure.